Hello everyone, I am Dr. Sharath Kumar, Consultant Surgical Gastroenterologist, Suyog Hospital, Mysore. Today I am going to make a short video on gallbladder stones. So what is gallbladder stones and what are its functions? Gallbladder is nothing but it's a pear-shaped organ which is situated in the right upper part of the abdomen, just below the liver. Usually the bile, which is a digestive juice which helps in the digestion of food, especially fatty foods, it usually produced in the liver and comes and gets stored in the gallbladder. And whenever we have a food, especially fatty meals, this gallbladder gets stimulated and release its bile into the intestine, which helps in digestion of food. So the function of this gallbladder is the storage of this digestive juice called bile juice. So how the stones are formed in this gallbladder? So usually the bile juice contains certain components like mainly cholesterol, bile salts and bile pigments. So whenever there is increased cholesterol content or decreased bile salts, what will happen, this ratio will be altered and this cholesterol will get crystallized and forms as stones. So this is called gallbladder stones. Usually there are three types of stones will be there in gallbladder. One is cholesterol stones, other is pigmented stones, and other is mixture of both of these. So most common stones in the gallbladder is the mixture of these both cholesterol and pigment stones. Next comes the cholesterol stones. So what are the symptoms of these gallbladder stones in the person? So the most common symptom if the patient is affected with gallbladder stones is the abdominal pain. Usually patient will be having pain in the right upper abdomen or upper middle part of the abdomen. Usually sometimes the pain will be radiated into the back of the scapula. And other common symptoms includes patient may get nausea or sometimes vomiting or indigestion. If the patient is having the features of cholecystitis, patient may be having fever or sometimes jaundice. So what are the risk factors for these gallbladder stones? Usually gallbladder stones usually more common in the females compared to the males. It usually occurs in the age more than 40 years of age. And the main risk factors will be the obesity. Whenever there is increased cholesterol contents, this cholesterol content in the gallbladder will get crystallized and forms the stones. And other risk factors includes unhealthy diets like eating high fatty meals or eating deep fried oil foods or sedentary lifestyles. And also it is more common in the female of above 40 years of age because of the hormonal changes. These chances of getting stones in the females are more common. And also the pregnant patients can get 30% increased chances of these gallbladder stones due to estrogen and progesterone hormones, which causes gallbladder decreased contraction of this gallbladder. Because of this, they may get 30% increased chances of gallbladder stones. In children also, gallbladder stones can occur because of some disease like hemolytic anemias. The children also may get gallbladder stones. So how do you diagnose these gallbladder stones? Usually we diagnose gallbladder stones by after examining the patient. We'll do a simple cheap investigations like ultrasound abdomen. In this only we can find out the gallbladder stones. Sometimes if there is a jaundice or if there is a fever or altered liver function test, in case of complicated cases we'll do MRCP investigation, which is nothing but an MRI abdomen. So what are the complications of gallbladder stones if not treated at the correct time? So patient may get acute cholecystitis where the gallbladder gets infected and patient presents with fever or sometimes jaundice. And sometimes the gallbladder can get infected with the pus, which is called empyema gallbladder. Sometimes gallbladder can go for necrosis, where we'll call gangrenous cholecystitis. Then most life-threatening or dreaded complication of these gallstones is two things. One is cholangitis, second one is pancreatitis. Because gallbladder stones can slip into the common bile duct and gets the bile flow will be obstructed from flowing from gallbladder or liver into the intestine, which may cause ascending cholangitis, where bile flow reverse back into the liver and from there into the blood and cause cholangitis, where patient will be having severe fever, chills, or sometimes hypotension and shock. Other life-threatening complication is acute pancreatitis. So what is the treatment of these gallbladder stones? The standard treatment for this gallbladder stones is the surgery, which is a standard laparoscopic cholecystectomy. There is no medical therapy or gallbladder dissolving therapy for this symptomatic gallbladder stones. The only option is the laparoscopic cholecystectomy. In laparoscopic cholecystectomy, we will do a small, less than centimeter incision, 5 small cuts, and then we go inside the abdomen through a laparoscope, and we remove the gallbladder. And also this patient, this can be considered as a daycare surgery, where the patient can be discharged on the same day or next day, and patient can be returned to his daily routine work after 3 to 4 days of the surgery. Okay, what are silent stones? Usually there are two types of gallbladder stones. One is symptomatic gallbladder stones and other is asymptomatic gallbladder stones. Symptomatic gallbladder stones means patient, what I discussed, with patient with symptoms, where surgery is the option. Other thing is asymptomatic gallstones, what we also call as silent stones. Means patient will go for some health checkup where they do ultrasound. In that they'll find out the gallbladder stones, but they won't be having any clinical symptoms. These are called silent stones. The treatment for this silent stones is reassurance. There is no need for surgery for this type of silent stone patients, and we can observe the patient, and in fact we have to tell the patient the symptoms and signs and complications in future they may develop. So how to avoid these gallstones from occurring? So we can prevent gallstones from occurring by maintaining a healthy weight, by reducing the obesity, and by taking a healthy diet like high fiber diets and fruits and vegetables, nuts, and we have to avoid high fatty meals and high carbohydrate diet, and also we have to avoid sedentary lifestyle, do regular exercises, and also we have to avoid alcohol and smoking, and also we have to reduce the weight gradually. We should not do rapid weight loss. Thank you.